Hi there. This video is a brief introduction to our Wellbe Innovate recall system. It's particularly aimed at receptionists, call handlers, care navigators, those of you who are speaking to patients and getting calls from patients to book appointments. First thing to say is please try and get in the habit of retrieving the patient record when they call up to book. Our systems won't work if you're just trying to book the appointment without doing that first. And often patients get mixed up about what it is they actually need. As well as responding to patients who are calling up to book their annual review, your practice may also have configured pop-ups that will give you opportunistic prompts to book reviews. So a patient may be calling about something they're concerned about, but it might be that we really need to see them for their annual review as well. And you taking the opportunity to book that might save further messages, calls, all sorts of extra work. Now, when you retrieve the record, whether you see it pop up or not, the thing to look out for is this green A. If you see it up here, it means there's some kind of appointment that needs to be booked. And clicking on that will work out what's the most important thing to book for this patient. We've developed the wording so that you can just read it out to the patient. So in this one, according to our records, you are due your COPD annual review and monitoring of your medication and PSA. Can we book that for you now? There's a bit more info here if you're not quite sure what some of those things mean. There are lots of options that we'll go through in more detail in other videos, but hopefully most of the time the option you'll be clicking is book. The system then works out what appointments the patient needs for this review. So in this instance, very simple, COPD including bloods. It may be for some patients that they need multiple appointments. Depends a bit as well how your practice is set up, but it's going to make the actual booking much simpler. So I click OK, and it brings up this really useful feature, free slot searches. I pick COPD including bloods, and it finds the possible appointments that are appropriate for this. So for this practice, for this patient, it's found half an hour appointments before our blood test collection with the appropriate nurses. I then find the one that I want to book. I double click it. Don't worry about that pop-up. And it takes me to this book new appointment. And as I can see, it's brought through that 30 minutes. And if I click up here on template and annual review, it just adds a bit of information there for the nurse, and it ticks this box here, annual review. Doing all of this is really useful because it means the system then knows the patient has been booked in for their review. We don't need to keep sending them reminders, and we don't need to prompt other staff in the future. I won't book that for now because I might forget to cancel it. But the other thing that you can see it does in the journal here, it's added a little bit of narrative to explain what we've done and some codes that the system will use to identify patients who've been booked in. To show you another example, this is slightly different in this scenario. So this is a patient who doesn't need their annual review at the moment, but they do need some other bloods. And again, there's wording I can read out. According to our records, you need an appointment for bloods, following changes to your medication and to monitor your kidney function. Can we book that for you now? Again, hopefully most of the time I can click book, tells me what to book, what free slot search to use. There's some information here about urine sample and trying to drink plenty before a blood test appointment, and then a slightly different appointment template that can be used. It does take a bit of getting used to, both for you and your patients. You may get a few more queries for a while. Our systems sometimes pick up patients who ought to be monitored but maybe haven't always been in the past. But the idea is that you follow what it says, you read the information out, you book the appointments, and life is simpler for you and better care is delivered to your patients. Thanks.